So I actually became the medical director for the Get Smart Know When Antibiotics Work program back in 2008, but it actually has been in place since 2003. And we looked at data comparing the time frame before the Get Smart program started and data comparing to the time after more recently, and so 10 years later, we've been able to look at prescribing changes over time. And what we've seen is that in particular for kids, we have seen about a 24% decrease in antibiotic prescribing for visits. So that means that there actually was behavior change. So we're talking about patients that have already made it to the provider's office. So we've seen a lot of improvements in pediatrics. Where we have not seen as much improvement is for adult patients. When we look at data of prescribing over time, the numbers and prescriptions per population have remained pretty steady. And we actually have seen some increases in prescribing for older adults. Interestingly, there's a lot of geographic variability in antibiotic prescribing, which has seemed to persist. We started looking at these data initially in 2010, and more recently, we're still looking at variability in prescribing across the country. We see that prescribing is higher in the southern part of the United States, particularly in the Appalachian region, than in other parts of the country. And what is striking is that actually prescribing rates in some states are almost or sometimes 2 times higher than prescribing rates in other states. So for example, West Virginia, which is the highest prescribing state, is more than double in terms of the prescribing rate compared to Alaska. We do know that when we've looked at data on antibiotic prescribing for conditions that don't warrant antibiotic therapy, so conditions like bronchitis, acute and complicated bronchitis, common cold, we see that there is a higher prescribing rate for these conditions in the South, in the Appalachian region, in those states where there are higher prescribing rates overall. So there is some evidence of a little bit more inappropriate use. However, when we compare our map to other maps, look at the map for obesity, for example, or the map for smoking, we see a lot of similarities. So there are some indications that the populations, in terms of the underlying health of the population, could be different in West Virginia and the Appalachian region, the South, as compared to, say, the Pacific Northwest.